I'm excited to be speaking to you about point-of-care ultrasound credentialing standards and keys to successful POCUS program implementation. My name is Dr. Tatiana Havryliuk, and I'm an emergency physician and founder of Hello Sono. I'm joining you live from NYC, and our mission at Hello Sono is to bring the benefits of point-of-care ultrasound to more patients by helping build compliant and high-quality POCUS programs. So just a brief agenda, and by the way, this presentation is about 15 minutes, and after that, we have some time for a Q&A. I first of all want to start off with what is POCUS and what it's not. And then we'll speak about provider credentialing, and the ins and outs of a successful implementation of POCUS. So what is point-of-care ultrasound? It's a clinician-performed and interpreted bedside ultrasound that is used to guide management on the spot. It's really meant to be quick, about 2 to 5 minutes, and it's super focused, answering very specific questions. The cool thing is it's also teachable and billable, and it comes with its own CPT codes. And it also the POCUS devices come in different sizes and varieties, from laptop systems to cart-based systems to now handheld devices. So you've got a lot of choices. What POCUS is not, it's not an ultrasound tech-performed procedure that might take 15 to 20 minutes and then interpreted potentially days later by a radiologist. And a lot of times, POCUS is just the first step in figuring out what the patient might need, and you might still be ordering a comprehensive ultrasound that I just mentioned, or you might want to skip it and get a CAT scan, or potentially you might not need any further imaging on your patient because you got what you need to know from your POCUS. So why is it important to credential providers? There are a couple of reasons for it, but really the basic reason is you want to ensure a baseline competency as those providers are making clinical decisions on your patients. And this is really also offers medical legal protection when you are using POCUS in clinical setting. Other things to consider is to ensure, this ensures that you are following medical legal that you are following current competency standards set by key organizations. And of course, if you're planning to bill for your POCUS, sometimes the payers will ask you for proof of training of your providers, so this is a way to do it. And a lot of times this comes up. What is credentialing versus certification? So the basic way to think about it is one is usually internal process and one is external. So credentialing is an internal process based on your current resources and goals for your POCUS program. While a certification, usually it's external, and there are all kinds of POCUS certifications that currently exist, and there's quite a bit of variability in how vigorous those certifications are. So you want to be really careful when you're choosing one. And by the way, neither American College of Emergency Physicians nor other medical organizations do actually endorse these external certifications. That being said, sometimes that's really the only option you have to get your providers credentialed, so they can fit into your credentialing guidelines. All right, and then let's go over what is really provider credentialing, what constitutes it. So what I'm going to explain to you now is based mostly on the American College of Emergency Physicians POCUS guidelines, and a lot of other organizations have followed those guidelines and implemented them as well. So number one, there is a component of passive learning. And passive learning usually consists of some kind of online course, watching videos, doing quizzes. There are also POCUS textbooks, but this is something that the providers are doing on their own. And there is a hands-on workshop that I believe is a really important part of provider credentialing and really achieving competency in POCUS. This is usually a 1 or 2 day workshop where really the providers are learning the hand-eye coordination, and they're getting feedback from the expert who's teaching them. And I'm seeing some comments over here. This is what POCUS really stands for. Credentialing sounds like a great idea. Thank you, Tetra. All right, and after your providers have completed some passive learning online and the hands-on workshop, they're not quite ready to make clinical decisions based on their ultrasounds. They need some experience, and this is where this preceptorship comes in. And really, it is recommended that for diagnostic ultrasound, the provider should be completing 25 of each exam type. So if they're learning lung, they're going to get 25 educational exams. Or if they are learning aorta, they will get 25 aorta exams that are purely educational, and they will interpret them and then submit them for review, where they're going to get feedback, and that's how they're going to learn to perform ultrasound and to achieve competency. So typically a minimum of 25 to sometimes 50 scans are recommended for each exam type. And if this is a procedural guidance, then it's really 5 to 10. So if it's ultrasound guided IVs or ultrasound guided joint injections, then it's 5 to 10. And finally, there's the assessment portion, and that can come in a lot of different flavors. So your providers can be doing online quizzes. Probably the best way to assess someone's skill is actually go at the bedside and watch them scan a patient and see how they're getting, what kind of views they're getting, how are they interpreting them. Some of the certifications will do assessments as well. And of course, when you're doing the image review, you can tell how many true positive, true negatives your providers are getting, and that can all be given as their statistic. And finally, say your providers do get credentialed and they're using the ultrasound, it's important that they maintain their credentialing. In general, you want to ensure that they're continually using it. And it has been this number has been thrown around to be 10 of each exam type per year to really keep up with their skills, and about 3 to 5 hours of CME every 2 years. And now switching gears a little bit. So say you're really excited, your providers are going to get the training, they are getting credentialed, and what do you need to really have a successful implementation of your POCUS program to ensure that it's really high quality, that it's compliant, and that you eventually can bill for it and have some income from this? I think the number one is you really need to have a POCUS champion, someone who's really excited for this program to succeed and really believes in POCUS and can be the person on the ground to answer POCUS related questions and troubleshoot. Number two, especially if you're part of a bigger institution, it's really important to get your IT department and biomed department involved really early on in the process, because the IT is going to be managing some of your software that you end up probably getting for archiving imaging and doing QA. And your biomed department is the one who's going to be in charge of your devices, right? And sometimes they already have preferences and preferred vendors. So definitely check with them first before you bring anything new into the organization. Of course, you need the devices, and as I showed you some pictures, there are so many different types. There are a lot of considerations of what devices to get. I think probably the main two things to consider is what are you going to be using them for? Those devices, right? Is this mostly superficial scanning, um, of soft tissues, musculoskeletal, or do you also need to have deeper imaging like the aorta and the heart? And then also consider your budget. Uh, Obviously, portability of your devices, it's their connectivity. Do you need a lot of AI features? Do you have a lot of novice users who would benefit from that? So that's really a whole session on its own. Um, Definitely, if you are ever planning to make medical decisions on your POCUS and also bill for it, it's important to save your images in a HIPAA compliant way. And really indefinite storage is recommended. So you really need to have a solution. Um, Super important is also to have protocols and clinical pathways in place. And by protocols, I mean, what are your infection control protocols for your POCUS device? What are your credentialing pathways? Are you going to allow your providers bring outside equipment, outside POCUS devices and scan patients in your clinic? So this is all really needs to be in writing to make sure you can reference that with your providers. Documentation, super important. That all charting, but documentation not only protects us medical legally, but it also allows us to bill for the procedure. So make sure that you have documentation templates that reflect the POCUS exams your providers are performing. Of course, your providers need to get credentialed, and that's a very important component of a successful POCUS program. Make sure you also have some kind of quality assurance process, and usually it is recommended that once your providers complete the credentialing, about 5 to 10% of their exams should be reviewed for quality even after that. Only after kind of all of this is in place is that your providers can get privileges or request privileges to perform the POCUS exams diagnostically on their patients. Especially, this is super important if you're part of a bigger healthcare system. And of course, billing safely and compliantly really should start after you've got all of these parts in place. And there's some additional considerations. Number one, I do recommend having strict clinical pathways for the use of POCUS in your institution, especially if you're just bringing it on and you don't have a lot of experienced providers. And the reason why I'm saying that is, for example, if you work in an urgent care space and there's an 80-year-old man that comes with abdominal pain, you probably just want this patient to get sent to the ER, get sent to get a CAT scan, rather than have your provider be doing POCUS and them looking at their aorta, right? So you need to make sure that it's very clear when POCUS needs to be used and what the limitations are of POCUS. I do recommend start small and pilot first to see what works in your at your sites and your patient population before you roll this out more broadly. If hands-on training is something that's really difficult to get for your providers, maybe you're really remote or a budget constraints, there's definitely an option to do SIM and teleguidance. So that's something you can consider. And final thing is it's super important to collect some data on patient satisfaction scores, your ER referrals, your provider satisfaction, the utilization of this tool, because this data will really help you decide if you want to expand your POCUS program and whether it's really worth it. And of course, also collecting data on reimbursement would be really important.